Hello, I'm Dr. Omar, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. We have a fabulous show for you tonight. I love that word fabulous because that's what it is. We're talking about myocardial infarction or a heart attack. Very, very, very important topic. And I have the best person in the world to talk to you about it tonight. But before, I want to thank you guys. I want to thank you guys so much for emailing me and tweeting me and letting me know what's going on in your minds out there about your bodies and about your health and how I can help you and what to put on the show. It's all good. Believe me, it's all good. Just keep it coming. I love it. I love it. My ego's going to be so big pretty soon just because you're connecting to me and you're letting me know what's really happening out there so we on this show can give it back to you, so we can do what you want us to do, let you know about your health. It's all good. Now, our topic. Oh, I forgot something. www.medmoments.com. Email me and tweet me at medmoments. Now, let's get to the topic. Myocardial infarction, very serious topic. And it's something that as we get older, it's a chance that any one of us can have this. Any one of us can have heart problems. I have the perfect person tonight to talk to you about this topic. His name is Dr. Lawrence Motti, and he's a cardiologist. He's going to talk about it from A to Z. Dr. Motti, welcome to our show.
Thank you, Omar. It's a pleasure to be here.
All righty. And as usual, I'm going to start off with my basic question. What is myocardial infarction?
Omar, myocardial infarction is basically a fancy term for a heart attack. Heart attack occurs when the supply of blood to the heart muscle is interrupted. Mm-hmm. This interruption can occur partially or completely. And when the heart muscle loses its blood supply, it can get damage to the muscle, or unfortunately the heart muscle may die. Mm-hmm. Heart attacks come in different shapes and forms. Mm-hmm. But let's not forget, any heart attack is dangerous and none of them are wanted. Mm-hmm. Heart attacks come in different ways that patients feel them. There are different ways they feel them, they sense them. As soon as the patient thinks, or if they think themselves or neighbors having a heart attack, immediately 911 should be called, or they should get to the closest hospital to seek immediate attention. Mm-hmm. In terms of how people feel these symptoms, there are a variety of ways that it's sensed by the body. The most common one is chest pains. We use that word loosely because sometimes the patient doesn't feel pain. Some people feel pain, some people feel pressure, tightness, heaviness. Some people feel, oh my God, I thought I had indigestion. Sometimes this sensation in the chest can be in the middle of the chest. It can move to your left arm, it can move to your jaw, it can move to the neck, it can move to your back. Mm-hmm. It can also go to your right arm. Sometimes it can be around your stomach area. Unfortunately, people can feel very sick. They can be severely diaphoretic, which means they can sweat a lot, unusual sweating, mm-hmm. unusual shortness of breath. They feel tired because the heart has lost its energy, its blood supply. The heart is not functioning. Therefore, immediate attention should be called, and they should really go to the doctor, immediately call 911. The word 911 is so important because time is of essence. Mm-hmm. Every minute, every second counts. This is not something that you wait to. If you think you're having a heart attack, you don't say, I'm going to see my doctor tomorrow. I'm going to wait till my family comes to take me. If you think you're having a heart attack, if you think your neighbor's having one, you must seek immediate medical attention or call 911.
Excellent. Let me just ask one. A typical patient that comes to your office, all righty, and they sit down and they started talking, how would if you suspected, what would a typical patient look like or sound like that comes into your office and you're thinking myocardial infarction or heart attack?
Sure. Patients can be in every form and shape. It can be male, female. Age usually is an older age. Mm-hmm. Technically we say male over 40, women over 50. Mm-hmm. But I just want to make sure that people don't realize that if they're 49 and they think I'm having a heart attack, they don't say, well, I'm not 50 yet. These are just general guidelines, general ideas. Usually it's in middle age or older age. Again, men 40s, over 40, women over 50. Generally, they say that they haven't been feeling well. The chest isn't right. Again, there's tightness, heaviness, indigestion, burning sensation. It may not necessarily, the word pain may not be used. The pain may move around as we described earlier. They're short of breath, they're tired. Fatigue is one of those things that cannot be underestimated because the heart is not getting blood. The engine of the body is not getting blood. No matter how healthy it is, if once the blood supply is obstructed, that the person starts feeling weak. If the muscle is not functioning, sometimes the fluid backs up to the lungs, they get short of breath, and so forth. They can feel palpitations, which means they're aware of their heartbeat. And sometimes these can be
like it's beating out of their chest.
Exactly. It can be dangerous and can cause them to get dizzy or lightheaded.
Right.
It was important to go back and talk about this. Sometimes the blood flow to the heart is interrupted in a partial way or a complete way. Of course, the complete way, if the blood flow is completed and there's no oxygen going, the person feels the sickest. It's important to talk about what causes the lack of blood flow. How come all of a sudden the blood gets interrupted? Well, usually the process is gradual. It generally happens that the foundation of the blockage of the heart has been set throughout the years. As I can show you with this model, if I may, this is basically cutting the arteries in the cross section.
Now, now, let me just stop you since we're just going to the arteries. Now, there are all types of arteries in the body.
Right.
Now, we're not talking about the general arteries of the body now. We're talking about arteries that supply blood to the heart itself. That's a whole different, or is that what we're talking about?
Exactly.
Okay, I just want to make sure that I understood what you were talking
about. Maybe I'll just actually, since you brought that very nice point, so the heart muscle sort of sits in our chest, it points to our left side, it's generally the size of our fist, and the arteries of the heart, they actually run over the heart, sort of through the heart over it. So you can see that this different vessels, different arteries, these are just there to supply blood flow to the heart muscle itself.
So it supplies blood to the heart.
To the heart muscle.
The heart has its own little blood supply going on there.
Exactly.
All righty.
Therefore, keeping the heart healthy so the heart can send blood to the rest of the body.
Gotcha.
And so that when the blood flow is interrupted, part of the muscle can get damaged or die, depending on how much blood flow has been interrupted.
So let's step back for a minute. There's for some reason, when we'll go into it, the blood flow to a particular part to the heart, that artery is flowing and it gives oxygen to that part of the heart. For some reason, it's cut off, and that part of the heart does not get oxygen for a while.
Exactly.
That's a heart attack.
That's a heart attack.
Okay. I just want to make sure that I understand so I won't be messing you up in the future. Go ahead.
Absolutely. So that lack of blood flow, lack of oxygen can cause damage or can cause the muscle to die off, depending on how little flow and how completely the flow has been stopped. So the cause of most common heart attacks is what we call atherosclerosis, which is a fancy term for plaque buildup, hardening of arteries. Arteries get calcified, they get hard, they're not healthy anymore. And then throughout the years, plaque forms in our body, in our vessels. Initially, we see that there is just a little bit of plaque, the yellow material, which is usually we think of fatty material, sits in our arteries, just causes a little bit blockage. As time goes on, the plaque builds up. This is really, really bad how the plaque gets more deposited, less opening of blood flow to get through, less oxygen to get through, and certainly as we can see here, the plaque is building up and the artery is really tight. The tighter the artery, the less oxygen and nutrients getting through, the more symptoms people have. And of course, once the damage starts happening, whether it's complete or partial, people don't feel well, and that's what we want to prevent.
Now this plaque, that's one of the reasons why we try to keep our cholesterol down? Is that part of all of this?
Excellent. You couldn't have made a more valid point. So part of this plaque prevention is cholesterol reduction, dietary changes. It's important to make sure that all the risk factors we'll talk about shortly are addressed. There are many risk factors, how people get sick, how people get heart condition. Again, aging plays a role, weight plays a role. The weight must be kept down. The good cholesterol must come up. The bad cholesterol must come down. Unfortunately, people with diabetes are at risk of heart disease and plaque formation. People with uncontrolled blood pressure and high blood pressure can be at risk. Cholesterol, and one of the worst risk factors for heart attack is smoking. Smoking or tobacco products can certainly cause plaque formation. These plaque formations can be very fragile, how they can crack, and different materials can come into the vessel and cause blood clots. That's why it's not only that has to be addressed, has to be immediately stopped to prevent the risk of heart attack.
Okay, but I want to go back to an important aspect. You said 911, and that's because if the oxygen does not go, is not presented to a particular part of the heart for a particular length of time, there may be dying of cells, heart muscle cells. And once
Exactly.
is there, after these cells are injured like that, can they repair themselves and can I get my function back, or is it once they're injured, and I'm always going to have a bad heart?
Certainly, the reason we brought up the issue of 911, time is of essence. In a lot of patients, if they get to the hospital early enough and we can help them to either minimize the heart attack or stop the heart attack, to improve the blood flow back to the muscle, a lot of the damage can be prevented, and hopefully the patient has minimum sensation that the heart muscle has been affected. One of the most important things about the 911 is that, as you said, as the heart muscle starts getting weak, damaged, dying, because the vessels of the heart is where the electrical system is, the heart muscle heartbeat is. These electrical systems get erratic, and erratic heartbeats can start developing, and patients can get very sick. And sometimes the erratic heartbeats are very dangerous, and people can collapse from them. So time is of essence, and having a medical personnel next to you is critical.
Okay, all right. Now, tell me, I understand that when we get older, we're more likely, but do young people, can a young person have a heart problem as well, or a heart attack as well? I know seniors, we always worry about seniors. Can it happen to a young person?
Absolutely. So there are young people who've had diabetes since their childhood days, so certainly, and that can catch up with them even though they're not necessarily 50, 60 years old. If they've had diabetes for 30, 40 years, certainly at a younger age. Again, childhood obesity can lead to heart disease at a younger age, younger than what we think of. Of course, unfortunately, younger people are starting to smoke earlier, and as they get to be in their early years, again, having had smoke perhaps from their teenage years, that catches up with them. And there's some social habits that people may have, some using drugs that can cause the heart muscle or the heart arteries to go into a spasm and form blood clots. Sometimes drugs that are illicit drugs, cocaine, can actually affect the blood flow and can cause heart attacks with blood clots. That's something that should be mentioned. That can actually cause critical heart attacks and fatal heart muscle damage.
Okay, so what you're talking about is that vessel around the heart actually spasm off and the blood can't go through.
Immediately stops the blood flow, blood clots form, and the heart starts getting damaged. Okay. Therefore, arrhythmias, irregular heartbeats can occur. Certainly, heart damage can occur. The heart muscle gets weak. Eventually, people can go into heart failure because the muscle is not strong enough to send the blood forward, therefore it backs up to your lungs. These are all the things that we try to prevent.
So what we're saying is that the heart loses its ability to constrict or be a strong muscle.
Exactly.
So the blood does not go through the chambers appropriately. So when you say heart failure, that means that the blood kind of pools in the lungs, and the liquid part of the blood kind of oozes out into the tissue and it gets soggy, and that's heart failure, sort of.
Exactly.
Okay.
So the heart basically has 4 chambers, as we can see, and the left side, there's a left side, there's a right side, there's the top and bottom, and the left side is the most important chamber, and as we can see that when the muscle of the left side gets damaged, the blood doesn't go forward. Therefore, somewhere up here is the lungs, and the blood sort of seeps back into the lungs slowly and shows that the heart muscle has gotten weak and heart failure has set in. Okay. And that's the whole thing comes back to the prevention, all the risk factors, as we mentioned.
Talking about risk factors, let's talk about genetics. Mom had a heart attack. Uncle Harry had a heart attack. Will I have a heart attack?
It's an excellent point, Omar. So it's one thing to say family history, basically genetics. So if my grandfather had a heart attack when he was 85, that's an appropriate age. That's something that we perhaps, even though we wish grandpa was living longer and he's okay, but having a heart attack at age 85 is perhaps not what we refer to as family history or genetics. Is when your family had unexpected early heart attack, very early, perhaps in their 30s and 40s. So men perhaps in their 30s or women in their 40s, which is not really the expected age. So that's when that considers to be a family history or genetic risk, that we really are worried about that. Some people come and say, everybody in my family age 30 had a heart attack and died off. That's a really big notice for us, that this person has to be taken care of immediately, has to be checked thoroughly with all the tests that his doctor or her doctor can provide to make sure that they're not at risk of a future heart attack.
Okay. What about race? African Americans more likely to have one than Caucasians or whites, or how does that play as far as myocardial infarction?
I think, unfortunately, it's a disease that goes across the spectrum. No race is safe, and most important is not necessarily that a particular race gets more risk of heart attack, is that depends on their risk factor. If somebody has more of a risk factor, longer duration of risk factors, then the risk of heart attack would be much more prevalent and much more common. It comes back to prevention. Prevent the risk factors so the body is taken care of. The body doesn't have those fatty, greasy material sitting on the arteries, causing blood flow not getting to the heart muscle, causing oxygen not to get there, causing good healthy nutrients not to get to the heart muscle. So by preventing these risk factors, the heart muscle will stay healthier.
Okay. Gender. Female, male. Okay. Younger, older, fat, or skinny, or whatever it is. The gender difference. Is there a gender difference with heart attacks?
Yes, there is. In generally speaking, men are at higher risk of heart attack than women. Okay. Women are protected by hormonal supplies that they have, that until after menopause, they're protected. So a few years after menopause, the risk of heart attack catches up with women, unfortunately. But in women that haven't had menopause, premenopause, the rate of heart attack is much higher in men than women. So women are sort of protected early on. But still, there are women who are premenopause, but they have risk of diabetes and high blood pressure, and they could still have heart attacks. So they should not say, well, this pain is not my heart because I'm not menopausal. Right. And just that every symptom that doesn't seem right has to be taken care of by the patient's physician immediately.
Okay, all right then. Now, what about as far as other problems that may come about because the blood flow is not going through appropriately? Does it affect other organs like your brain? Can that be affected, or the kidneys, or
Sure.
How does that relate to other organs, the heart? Because I know it's a major organ in our body. Without Absolutely. It beating, we're not going anywhere. That's for sure.
Absolutely.
But how does it affect other organs?
So any stoppage of blood flow to the heart muscle makes the heart muscle become weak, and not only its own muscle doesn't receive any blood flow, and once the heart muscle is weak, it can't send blood to the rest of the body organs, the major organs of the body, the brain, the lungs, the legs, the liver, the kidneys. They'll be starving for blood because the heart is not able to function and send blood out to the rest of the body. So lack of blood flow to the oxygen can lead into stroke complications. Lack of blood flow to the kidney can have kidney failure. The blood pooling into the heart muscle itself backs up to the lungs, and the lungs fill up with water, and they need someone like you to get that out of them and help them out. And it's blood pressure can be low, and people can pass out. They can get dizzy, lightheaded, or again pass out. Certainly, it's important to be aware of that irregular heartbeats. Some of the irregular heartbeats are unfortunately fatal. That's why immediate attention by medical personnel are there to make sure if that the heart becomes erratic, they can sometimes restore the heartbeat into a normal fashion with special machines that they have.
Now, what about, and I understand with diabetes because it's a very, very important diagnosis in heart attacks. Tell me about diabetes and how certain diabetics do not feel chest pain, I understand?
Absolutely. So getting back to the symptoms of heart attack, so we discussed chest pain, we said it can be different chest pain, but there is a certain number of people who have problems and they cannot express their symptom. So there is a component of patients who we call silent heart attacks. The heart attack occurred, they didn't know about it, and that's a different group of patients that have to be taken care of. And then sometimes there will be diabetes, since the nerves are numbed, the nerves are not functioning as well as it should. The patient cannot perceive that pain or pressure. Therefore, with diabetes, they're at much higher risk of prevention of heart attack. Make sure that they're attended to, and make sure that tests are done to make sure that there are less risk of having future heart attacks. So that's a very important topic to remember.
Okay, all right. So let's look at this. As far as chest pains are concerned, I just want to make sure that patients understand, or people understand what to look for, because if you miss the symptom, we may not see you tomorrow.
Absolutely.
So we really want them to understand what the symptoms are. So the chest pain, it can be different types, like sharp or tight, or like an elephant sitting on my chest and I couldn't breathe. That kind
Absolutely.
of stuff. And tell me where the chest pain may radiate again. Tell me where those sites are, so we understand that if this is happening, I should really either, if I'm having serious symptoms, I should go call 911 or see my doctor.
Right. So generally, the pain is in the middle of the chest, a little bit to the left, and it can move anywhere it wants to. Really, there's an old saying that heart attacks.
It won't stay home.
It won't stay home. It move, it's trying to give you a signal. It can certainly move to the left arm. It can move to the jaw. It can move to your neck. It can certainly go to your back, straight through to the back. It can certainly even involve the right arm. It can involve the stomach area. People feel very weak, as I said, very sweaty, unusual sweatiness, and that should be warranted to seek medical attention.
Okay. Now, the thing of it is that you said the beats. How do our heart know that it, number one, it never stops beating?
Thank
That's
God,
the
right.
marvel of all of this. How does it know? How do the chambers know which chamber should beat and which chamber should stop, and when the blood flow? This is all synchronized here. You have 4 chambers, blood going through all different directions. How does it direct all of this stuff?
Absolutely. So again, the heart is amazing. So instead of this right upper chamber, there's the electrical center of the heart, almost like the transducer, almost like at our home where we have our electrical wires.
Wait, you mean we produce electricity?
They're little electrical fibers that send little electrical impulses to the heart muscle. The heart muscle can contract and relax, and it's done in a very sequential way, almost like the amber light of the traffic light. It sends a signal from point A to point B. Point B stops for a short time, then goes to the rest of the heart muscle. So it doesn't get erratic. In a very sequential and systematic way, the heart contracts equally and symmetrically over and over. Without us thinking about it, it's on autopilot. The brain and the heart have this whole thing figured out. They don't even need our help, thank God.
Well, listen, let me talk about diagnosing. You got the patient in front of you. You know, whoa, that patient's having a heart attack or had one. What do you do? How do you diagnose this problem?
Well, if they happen to walk in the office and I feel that they're having a heart attack, again, first thing, 911. Of course, while I'm waiting for 911, we control their blood pressure, we lie them down, we try to make sure that their oxygen status is good, they're breathing good, and once 911 comes, they're hooked up to machines and taken to the closest emergency room. That's the key, the closest emergency room that they can provide adequate care. Right. So the doctors, or the patient's doctor can actually help them to restore the blood flow. And there are a variety of ways like that can be done. Once the diagnosis is made, it's done through obviously talking to the patient, examining them, doing something called EKG, which is connecting multiple wires to our legs and our hands, our chest, that actually record our heartbeat. There's electrical system message that we're talking about. And they have to look sort of a normal way for everybody. And if they look extremely unusual and abnormal, then the physician can diagnose most of the heart attacks that way.
Now, I know that everybody doesn't have a heart attack. As you said, sometimes the plaques are there, but the canal is still open. Are there other tests that you use, like things I've heard of, like things like stress tests? And you know, that's a big one. I'll send you for a stress test.
Sure.
What does a stress test do? And then we'll
So stress is a great test that's usually done in poor cup and the prevention of the heart. So if people who have they feel well, or maybe, of course, we don't think they're having a heart attack. We think they just want to make sure that they're staying healthy. So in a healthier individual who want to make sure that they're in good shape, that we can give them the okay to go exercise without any risk. The doctor sends them for a stress test.
Right.
They walk on the machine, and every few minutes the machine goes a little bit higher and faster, so we can watch their heartbeat, watch their blood pressure, watch the EKGs every couple of minutes, make sure that there's no lack of blood flow as they're stressing their body. And if that stress test is good, they're allowed to exercise to reduce their risk factors.
Okay, and it means that their arteries are nice and open, and you can go ahead and do what you got to do.
Well, unfortunately, it's not a perfect test, but it's a screening test that we use. There are many other tests that can be done afterwards, but it's a good start for people to talk to the doctor and follow through.
All righty. Dr. Mahdi, thank you for covering this subject. It's such an important subject, and I'm so happy that you were able to take time from your busy practice and come and talk to us about myocardial infarction or heart attack.
Omar,
Thank you very much.
Thank you so much for having me. It's a great show. Thank you.
All righty. We have just a minute or so to talk about our Let's Talk segment, and today I would like to talk about seniors and falling. You know, fall prevention and tips that may prevent someone from falling, because what we think about is a senior falling and breaking a hip. That's the worst thing that can happen. Listen, 1 out of 3 seniors fall. And every time they fall, because their bones are brittle and they may not have the strong bones that they had when they were 20, it's a chance that they may break a bone. And it takes a long time to heal once you're older. Alrighty? So we want to make sure that things are such as the carpet is not irregular, or when the snow is taken up from the driveway when they're walking. Just be careful with our seniors and falls. Alrighty. As far as closing, because we got to go and the show is over. But listen, sharing and caring, email me or tweet www.medmoments.com and tweet @medmoments. I want to know what's going on out there. Remember, never institute any change in your medical therapy until you see your physician. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all.
Thanks so much.